What's so special about New Orleans, or what makes New Orleans special, is we have a very unique culture. I am originally from Guatemala, but I grew up here in New Orleans, so I consider myself a local. My dad was just sort of a regular Midwestern doctor who actually fought in World War II and just decided he wanted to do something a little more altruistic with his life and moved down to Guatemala to open up a community health program, promoting sort of grassroots healthcare. Community involvement in healthcare and that improvement of healthcare is sort of what we grew up around. I'm a history major originally, and after Hurricane Katrina, it became obvious that, other than sort of a big natural disaster, I think for those of us who lived in the city before and just saw the drastic changes in the city and the destruction of the city, it kind of made us think of what's important to us, and also how can we contribute to bringing the city back to where it was or making it better than it was before. And one of the areas that I think always comes up is, and was always near and dear to my heart, was healthcare. So I went back to college and decided to go into public health. In healthcare quality and risk management, our big focus is always on the patient. How are we going to improve the patient's care? How are we going to make sure the patient is safe so that they don't get sicker in the hospital?
What we're trying to do is prevent harm from coming to patients when they come through our doors. What I would say from an infection prevention standpoint is we want to make sure that when people come to our facilities, we are preventing infection in them. So that might be things like preventing central line infections.
Last year during the Ebola crisis, we wanted a way to quickly identify any patients that may have had exposure to Ebola.
So we asked for an alert.
Whether they'd been in one of the countries that was affected by the virus or whether they had come into contact with somebody.
So in discussing with RL, there are all these pieces, we're not sure how they're all going to fit. Really the answer from everyone at the team was we'll figure it out together. And I don't think we really had that feeling from any other vendors when we were going through that process.
And so what we did with RL, I think, was something that we don't even know if anybody else had done that before. And they're always ready to tackle it.
We use several of the RL Solutions modules, which here we call SOS.
So now what RL does is it provides one platform in which we can tabulate and look through our data, support what we need to, and then be able to report out on that.
One of the features that we use the most in RL6 is we use their alerts and their scheduled reports. We've set up a high severity alert so our senior leadership can know when there's a high severity incident that happens around the system.
So in our efforts to be proactive, which is very important in preventing adverse events, it's not enough to know that there was a mistake made. We really need to find out why. The collection of data is a critical element.
RL6 helps us be more proactive about identifying issues in patient safety and being able to correct them before they occur. So rather than looking at data retrospectively, we're able to address problems before they happen.
So it's important to be proactive in terms of prevention rather than reactive. We're trained to be reactive. So in medical school and residency, we're trained to respond to diseases. However, being reactive is not the way to get optimum safety. You wouldn't ever want to get in a plane if their thought was, we're not going to prevent an accident, but we'll make darn sure we do a good job if we have one. That would not be acceptable. And it's not acceptable in hospitals either. We need to create the connection for people that when they report, we may find something that truly saves a life. It's such a gift for us to be able to give that back to them and let them know what they accomplished. And it really changes the whole culture within an organization.
Healthcare and public health especially has been very important to my family because I think we've been able to see the impact that that has on the community, on improving the community as a whole. Through the work that we're doing, through our quality department, we're making a difference in patients' lives every day, whether they know it or not.